And breathe it all out. Good. Little lift and twist. Good. One more. There it is. We did, kind of. You did the bump over to yeah. Are we still going? Oh, God. Okay. Hey everyone, Dr. Angie here. We have student Dr. Kendra with us. So she came up to me earlier and she goes, I'm having this weird rib pain. She was pulling needles from a patient and just randomly felt some pain. Go ahead and turn for me. Like right around here. So like underneath that scapula. And I'm going to have her do the same thing I did earlier. Go ahead and lift your arm for me. So I'm trying to isolate, see if it's something that's related to her shoulder, to the muscles, to the scapula. All of her pretty hair out of the way. Go ahead and bring it up to the side. And so we're not really getting much change with it as we move, but go ahead and twist for me. Twist your upper body. That's where we feel it. So we get more of that irritation. A lot of times with rotational movement in that area, we're still getting more rib fixation that's going on. So oftentimes with rib irritations, you're going to get difficulty to take a really deep breath in. You're going to feel that pain. Sometimes it's more central to the spine. Sometimes you can even feel it kind of penetrate through, almost feel like it's chest pain. So I've seen people before where they're like, I thought I might have been having a heart attack. Should I be worried? Is it angina? Something that's going to be more problematic. But then we adjust them and we talked about the rib fixation, and that's the issue. So we're going to go ahead and treat Kendra here. I'm going to have you lay face down for me to start. Awesome. And we're still going to get some of her mid-back adjusted just to make sure everything's aligned in that regard, where that rib articulates with the spine. And then if we need to, we can do a little bit more specific to the rib. And because it is a little bit lower, I'm going to use my lift for you. All right, so right in here we get some of that fixation as well. Go ahead and take a breath in and breathe it all out. Good. She's a super easy adjuster. Makes our jobs a lot easier. Cool. And then that lift I'm talking about, I'm going to be on the other side of the table. I do a lift here from the hip, and I'm going to apply a little pressure here. Just want you to try relax. Little lift and twist. Good. One more. There it is. Nice. Cool. Other ways we can do that adjustment are laying face up, and it's usually for the higher ribs. It's easier to get in that area, but for hers it was right down in here. Still might be a little tender just from the muscles. There's muscles between your ribs that can articulate in that area, or can, I would say, tighten up in that area. So we still might have some tenderness. The other thing we're going to do for her today is laser. All right, bringing you back up. And that's a treatment for rib fixation. Cold, sorry.
The long-fat costume.
You could always cut that.
Carly, make the camera wear glasses, please.
Make the camera wear glasses? Do you actually?
Does everyone have their glasses on?
I guess I should put on mine, even though I don't really need on mine.
I almost stopped you, by the way. Mid-video, because when you said pulling needles, I didn't process I'm allowed to pull needles, but you can't push them. So right away I was like, well, you can probably see my face in the video. You're like,
I'm going to do 4 minutes, okay?
I know the concept. The problem is they feel like everyone's so usually the world has gotten together at a conference and decided to just
Son of a gun.
That was a very fast 4 minutes.
Because like
did I even sleep?
I don't think I got my nap in.
Another 4 snooze. Another 4 minutes.
something, whatever. Same for friends like you, so you have my grandmother sewing machine that's like 100 years old. Like literally. I'm hoping maybe that one will be able to beat him.
It's so weird that it vibrates and it's like angry.
Yeah, I know.
It's in case you're blind and you're operating the device. You can't see when the light goes red.
I always wondered, like, patients can't feel it.
The vibrating.
It's
You
very
didn't feel
light.
it?
No, it's super light. So
I can roll this up a little bit more.
sometimes patients won't even know.
That's good to know.
Ooh.
Tender like a chicken.
Yep.
Tender.
okay with those?
Sure.
Alright, I guess you're on here for 10 minutes and then do exercise. Okay?
Okay.
This is the type of treatment that makes you want to go to sleep.
Ribs are also just a tricky one to go over just because there's not much, like surface level. It's very superficial.
When you get like closer to my spine and then you go outward like right in there, that's when it like right there. Yeah, that's like
The tender spot.
Yeah.
Not getting too warm, is it?
Nope. It's comfy.
That's good.
Disturbing her nap.
Yeah, how much longer do I have to nap?
54 seconds.
It's like when we finish, we set a timer. Another 10 minutes just to hang out with the needles.
Just to let her rest with it.
Big needles.
It feels bumpy.
Do you have bones?
I didn't know.
I was gonna say, I was like, you yourself are not bumpy. You just have bones.
I thought you were going to tell me I have strong muscles in my back.
You also have those. You have strong muscles and knots in your back.
Yeah, that's true.
That's true. Now that I made you say what I wanted to hear, that is true.
That's very true. Thanks, Dr. Angie.
You're welcome. There you go.
Thank you.
You can lay there for a bit. No, let me unplug
Okay.
the machine
She
before
said for
I
a
try
bit.
to roll it away.
I'm just
Okay,
gonna keep.
bye.
Okay, there you go.